After treatment, they go back, live in your service apartment during this thing. But that Tamil Nadu and Chennai in particular, and hospitals, quaternary and tertiary care institutes are providing state-of-art care is something which I am very proud of, and I am very proud that I was associated. Now I am associated more with nutrition, which is again in a way linked to this when you look at social determinants of health. So we all should continue to work together and make these kind of things very popular. என்னோட நண்பர்களுக்கு சொல்கிறது மிக ஒரு சந்தோஷமான விஷயம் தட் இந்த மாதிரி எல்லாமே அடுத்த கட்டத்துக்கு போகிறோம். வந்து ப்ரைமரினா ஆரம்ப சுகாதாரம், அதுக்கப்புறம் நடுத்தர செகண்டரி ஹாஸ்பிட்டல், டிஸ்ட்ரிக்ட் ஹாஸ்பிட்டல், தாலுக் ஹாஸ்பிட்டல், அடுத்தது மெடிக்கல் காலேஜ் ஹாஸ்பிட்டல் சேர்ந்து ஒவ்வொரு ஸ்பெஷாலிட்டிலையும் அதுலேயும் ஆஸ்மா கிளினிக்கு தாண்டி சிவியர் ஆஸ்மா கிளினிக்குன்னு இவங்க கொண்டு வரது நம்ம ஒரு மெடிக்கல் லெவல்லையே ஒவ்வொரு நோய்களுக்கும் அறிகுறிக்கும் அடுத்த லெவலுக்கு கொண்டு போகக்கூடிய வாய்ப்பில் என்ன அழைத்து அவங்களை லான்ச் பண்ணுறதுக்கான வாய்ப்பை கொடுத்ததுக்கு அனைவருக்கும் நன்றி கூறி விடைபெறுகிறேன். நன்றி, வணக்கம்.
Dr. Meenakshi ma'am to please present the memento.
Thank you, sir. Thank you, sir.
Our chief guest, Dr. Radhakrishnan sir, who's accepting this invite with even his busy schedule. So mainly, to encourage our take the same strip. It could have been prescribed 20-30 years back by some private practitioner, but still they are continuing to take the inhaled corticosteroid and then related with a lot of side effects. But now, in order to prevent those kind of oral corticosteroid related side effects, a lot of research is happening day by day, and they have come up with a lot of biologicals. That is called, we have currently asthma patient, and then what are the current treatment options, modalities are available. to overcome the conventional oral corticosteroid related. So, as you all know that the asthma is mainly a heterogeneous disease characterized by chronic airway inflammations with a history of asthma, history of wheezing, shortness of breath, chest tightness and cough that may vary time and intensity together with variable airflow limitations. So this is the prevalence of the asthma. If you look at the prevalence overall, globally almost 358 million people are suffering from asthma. But if you look at the Indian scenario, almost nearly 38 million people are suffering from the asthma. The worrying part is globally, the mortality rate wise, India is the leading cause of death especially in the asthma group. So by 2025, almost an additional 100 million people are going to be affected by the asthma. That's what is predicted. So this is one of the insight study why we are going to start this biological therapy. So if you look at our asthma patients, almost 100% of the asthma patients in India are either partly controlled or uncontrolled, because none of the patients are going to be a well controlled group, because not many people they are checking the inhaled techniques, whether the patient is taking correctly or not, whether the patient is adhering to the medications or not. Only they will prescribe, but they will have a lot of exacerbations, and ultimately the patient will have repeated symptoms and repeated exacerbations. And almost nearly 42% of the asthma patients in India having day-to-day symptoms every day. Nearly more than 30% of the patients in India reporting daytime symptoms, nighttime symptoms every night. So almost 67% of the asthma patients in India reported exacerbation every year. So nearly 80% of the patients, they're missing their works or school. So because of asthma symptoms.